Sailon. I'm a social worker and an addictions counselor from Denver, Colorado, and I am the operations manager for the STAR program, Support Team Assisted Response. And I'm here to talk to you a little bit about how we have focused on sending the right response to 911 calls in Denver. So a little background on the STAR program. Here in Denver, we have seen the number of mental health calls coming into the 911 system rise year after year. And we have traditionally sent police, fire, or EMS to assist with these calls when someone calls 911 in crisis. And really looking here in Denver at creating a menu of options outside of those three traditional response pathways to send when someone is in need of assistance in our city or is in need of support or resources. So the Denver STAR program is modeled after Cahoots in Eugene, Oregon. In May of 2019, a large delegation from Denver, myself included, traveled out to Eugene and did a 3-day site visit with Cahoots, and we're really able to see how their program that's been operating for over 30 years and has seen a ton of success works, and really started thinking about how we would bring a model like this back to Denver. It's also important to note that since the spring of 2016, we have run a co-responder program here in Denver that pairs a licensed mental health clinician with the Denver police officer. They ride with an officer for their entire shift and respond to mental health calls and are able to provide support, resources, trauma-informed approach, and a clinical lens on active police scenes. So we've had that running for a number of years and really realized through running that program that folks call 911 and police non-emergency for a variety of reasons, some which require a law enforcement presence, some which require a co-responder to respond with that officer due to scene safety or a risk element where that officer keeps the clinician safe while they are providing support and resources on that scene. And then there's a whole other category of calls that really don't require any sort of first responder. They don't have a risk component. There's no weapon present. No one is experiencing an emergent medical issue and really could be routed more appropriately to a civilian team. So started thinking about STAR and how we would develop it. It pairs a mental health clinician with a paramedic. How the STAR program was formed and doing a program overview. Here in Denver, we've seen the number of mental health calls coming into the 911 system rise year after year. We started looking at how we could send the right response when someone calls 911 in Denver. In May of 2019, we went out to Eugene, Oregon. The STAR program is based off Cahoots, which has been running successfully for 30 years. And we did a 3-day site visit. A large group from Denver got to see how Cahoots operates, do ride-alongs, and really started thinking about how we would bring a model like this back to Denver. Taking a look at how the STAR program was developed here in Denver, we have seen the number of mental health and crisis-related calls coming into the 911 system here rise year after year. And we have traditionally sent police, fire, or EMS to assist with these crisis calls and really started looking at how we send the right response when someone calls in need of support, in need of resources, or is in crisis. It's important to note that we have been running a co-responder program here in Denver since the spring of 2016. That program pairs a licensed mental health clinician with the Denver police officer, and that clinician rides with that officer for their entire shift and responds alongside them to mental health calls. So we've been doing this work around creating additional response pathways for a number of years. And what we recognized running those calls with DPD through the co-responder program was that when people call into 911, they sometimes require one of those traditional response pathways of a police car, fire truck, or an ambulance. Sometimes we need to send our co-responder alongside that police officer to provide a clinical lens, resources, and a trauma-informed approach on active police scenes. And we need that officer there with the clinician because of some sort of higher acuity issue, some sort of safety issue. We need that officer there for that scene safety component. And then there's a whole other category of calls that come into the 911 system that are more appropriate for a civilian team. They're low-level medical issues that don't require an ambulance response. They're resource requests. They're issues that are public health in nature, or they're low-level crises that don't require an emergent response. So we started looking at different models to employ to sort of add to our menu of response options here in the city and county of Denver. Of course, we looked to Cahoots, and in May of 2019, a large delegation from Denver went out to Eugene and got to spend 3 days on a site visit with Cahoots and got to see how their program operates and how they've had so much success. We started thinking about how we would bring a model like this back to Denver. And we started developing a pilot program. We wanted to pair a mental health clinician with a paramedic or EMT. The clinicians are employed by the Mental Health Center of Denver, which is a large community mental health agency here in the city. And our medics and EMTs are employed by Denver Health and Hospital Authority. They're part of their paramedic division. So on top of our co-responder program that pairs a clinician with an officer, we developed a model and began developing a model where a police officer is not part of the team. And this is really a force multiplier for our police department and our co-responder programs. They can focus on higher acuity issues where there is a risk element, while we're more appropriately diverting these low risk, low acuity calls to the STAR program and the civilian team on the van. So how did we build the STAR program? When we came back from our site visit in Eugene in May of 2019, we developed a large community work group that involved city stakeholders, people with lived experience, community providers, and we started thinking about how we were going to roll this out. How were we going to designate calls that were appropriate for a civilian team? There were obviously concerns about safety and liability, and really wanted to make sure that we were sending STAR to the appropriate calls. So we began developing a set of nature codes that indicated that someone was in need of assistance, but did not pose a safety concern for the civilian responders. And you can see that list of nature codes here on the slide. That was our starting point. And also important to note that all of the dispatchers and call takers here at the 911 Communications Center in Denver were trained on the new resource. Their call taking procedures didn't change. When people are calling here at night to 911, they're immediately asked their location, if anyone is injured, is there a weapon present? Is there a time issue where we need to send a lights and sirens emergent response? And is there a suspect? Has a crime been committed? So if all of those answers are no, then our call takers can start thinking about STAR eligibility. Talking a little bit about these nature codes, assist. A good example of an assist call would be an individual took the bus from Philadelphia to Denver and ran out of money and doesn't know where to seek resources or where to go next. That's a non-emergent issue. There is no weapon present. There's no injury. Someone is just calling 911 or non-emergency because they need help. And we can send STAR to help that individual who may be more appropriately able to connect them to a shelter or our Families Reunited program through Mental Health Center of Denver, where that individual could be sent back to a family member in another city where they have support and resources. And STAR is able to do that more efficiently than a police officer or an ambulance would be able to. Important to note also that the suicidal series nature code that you see on this list, those are non-emergent crises. So that is someone who is experiencing suicidal ideation, who is not in imminent risk, who is safe enough to wait for the civilian team on STAR to arrive. If someone is an imminent risk, we would send a co-responder team to provide support and conduct a mental health evaluation, make sure that person is safe, connect them back to ongoing resources, but we would do that alongside an officer so that that team could get there quickly and make sure that that person is safe. Trespass or unwanted persons. We have a large unhoused population here in Denver who, tends to hang out downtown. And some of those individuals don't access shelters because of various barriers and issues that they experience and prefer to stay outside. They prefer to camp downtown. This results in housed individuals calling 911 or non-emergency to report downtown encampments. And we can send STAR to provide those individuals with outreach, with resources, with supplies, which I'll talk a little bit about later in the presentation, and just be a more supportive response and a more appropriate response for individuals in our community who may be struggling with behavioral health issues. They may be struggling financially. They may be struggling with chronic health issues that are not well managed. And the clinician and medic team can really cover all of the bases along the continuums of physical and behavioral health. So the clinician's there to be trauma-informed, to be person-centered, to use harm reduction when people are not ready to make a change. And the medic can really consult with individuals and triage low-level medical issues. So they do a lot of wound care. They consult with people on what medications they're taking and can sort of triage people appropriately to the right level of care. Really stopping that cycling that happens in and out of the ER with individuals who have chronic health issues that are not well managed, are taken by ambulance to the hospital because of a lack of a better option, are stabilized and are then released. And because those chronic health issues are not well managed, they wind up right back in the ER. Our medic can triage folks appropriately to urgent care, back to physical health clinics. We have a number of clinics that we can access here in Denver so that folks can engage in that follow-up care that they were lacking, and hopefully stop that cycling in and out of the ER, which typically does not solve the issue and is also a very expensive resource. So looking a little bit at the STAR data. So the STAR program rolled out June 1st of 2020 after about a year of planning with the community work group that I spoke about earlier. And since June 1st of 2020, we have run 2,294 calls for service that would have otherwise been dispatched to police, fire, or ambulance. And we have never had to call for police backup due to a safety issue. I think that speaks to two things. I think one, it speaks to the fact that our dispatch protocols and processes are working appropriately. We're not being sent to calls where we show up and we're finding that we're in way over our heads and need backup. And also speaks to the fact, that the team on the van has the experience to handle these issues and is not feeling, like things are escalating beyond their ability to help and support folks. We ran our pilot program Monday through Friday, 10 to 6 in our downtown corridor, which was determined to be our highest call volume area for STAR eligible calls. We were very busy and very well utilized. And it's also important to note that about 70% of the time, STAR is directly dispatched through 911 communications, 2 calls coming into the 911 system. About 20% of the time, officers were showing up on scene first, recognizing that they weren't the right response, and keyed up on the radio and asked STAR to come take over the call. So we have an excellent working relationship with Denver Police. They appreciate this resource. They utilize this resource. And that collaboration in the field has been incredibly helpful. And we're very lucky that our officers recognize, hey, this really doesn't require an officer, and I'm going to call for STAR to get this person a more appropriate response. I think that's good community policing, and has, really helped contribute to the success of STAR. And the other, the rest of our calls are self-initiated action. So STAR is driving down the street and sees someone sitting on the sidewalk crying. They will stop and contact that individual and, see if we can assist them in, any way, provide support, provide resources, so they will self-initiate those calls in the field, because the best type of 911 call that happens is the one that never gets called in. So if we can stop and head some of that off ourselves, we absolutely will. So we ran the pilot for about a year. We're very successful, and there was a large investment made through the Caring for Denver Foundation and also through the city to expand the STAR program. So we are currently building our capacity to a citywide response, building up to 9 teams and 6 vans, and they will be working 7 days a week between the hours of 6 a.m. and 10 p.m. Through data collection, we have determined that is the highest call volume time for STAR eligible calls. We want to put our initial set of expansion resources where they are most needed. Our most common calls are welfare checks and trespass or unwanted party, followed by individuals who are experiencing suicidal ideation. The majority of the individuals served during the pilot were our unhoused neighbors. That is, largely because our pilot area, Police District 6 downtown, is sort of the center of resources and where a lot of our unhoused folks tend to be during the day. So really looking at how STAR is integrated into the 911 system here in Denver and into the public safety arena, we really see STAR as an and, not or approach. We are not replacing our co-responder teams with the STAR program. Both of those teams run very well side by side. They collaborate in the field a lot, and we will continue to run both programs simultaneously. We want clinicians showing up with our officers when there is a scene safety component, and we need that law enforcement presence to make sure that the scene is safe for the clinician. And then we'll still have STAR for when those resources are not appropriate and it's more appropriate for civilians. I worked with the co-responder program for many, many years. I wasn't really sure how the partnership between clinicians and police officers was going to look in the field. Oftentimes you think it's kind of an odd couple situation. You have a social worker and a police officer working side by side, and people are like, how does that work out? It has been very successful here in Denver. Denver police really think of us as part of the family. They've embraced both the co-responder program and the STAR program, and consistently ask when we're getting more co-responders, when are we getting more STAR vans. So we're very lucky to have such a progressive police department that has really embraced these programs and supported them throughout, the pilot phases and citywide expansion and all of the different phases that we've gone through. Our officers are dealing with a situation where call volume is very high in the city of Denver, recognizing that we need our officers responding to law enforcement calls, to weapons calls, to, things where crimes are being committed. And they're really appreciative of the fact that STAR acts as a force multiplier for them so that they are not sort of tied up on these calls that really don't belong on law enforcement's plate, but have wound up there because of a lack of a better option. So this allows them to focus on the work that they love to do, on keeping our community safe, investigating crimes, and allowing STAR to provide things like courtesy rides, supplies, resources, connection to longer term support so that folks aren't popping up on the 911 system over and over. I mentioned some of the supplies that the STAR van carries. We carry things like water, socks, gloves and hand warmers in the winter, sanitary products for women, harm reduction supplies, safe injection supplies, portable syringe disposals, anything that we can offer folks in the moment to not only say that we're there to help and support, but to show that through providing them with supplies that may assist them throughout their day. And we've seen a ton of success. And folks are very, very appreciative of that. So officers know that we have those things and are able, to have us come by and provide those to individuals who may be unhoused or who may be injecting drugs to make sure that they are safe and healthy, until they are ready to make a change. Really looking at how STAR will support the citywide. We've been breaking out into other police districts. Districts are requesting us, officers are requesting us around the city. And I think that just really speaks to the strong partnership that Denver Police and STAR and the clinicians working in the co-responder program have. We've been lucky enough to see investment from the city and from the Caring for Denver Foundation for both programs to expand these programs and make sure that we are meeting the need citywide. In conclusion, I will say that I don't think that these programs can be truly successful without law enforcement collaboration. Our officers are out there keeping our community safe, are out there contacting individuals. And if you don't have buy-in from law enforcement, you are going to miss out on a large number of calls where officers are showing up first and can then potentially do a warm handoff to a program like STAR. So we're very lucky here in Denver to have such a great long-standing working partnership with Denver Police. And we will continue to build on that partnership and utilize that partnership to really provide the right response when someone is calling 911 here in Denver. Thank you. I appreciate your time.